Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about movement disorders that are actually likely caused by Lyme disease. The most important one is Parkinson's. Now, I want everyone to know that I don't believe that all Parkinson's disease is Lyme. I think there are people who get Parkinson's disease from being exposed to too many chemicals. And we know that because the two states that have the highest incidences of Parkinson's is Florida and California. And those happen to be the two states that have the most golf courses. And what do they spray on golf courses? They spray pesticides. So I think that overexposure of pesticides can also be a reason that people end up with a movement disorder like Parkinson's or supranuclear palsy, which is another movement disorder. But movement disorder, Parkinsonian-like movement disorder can also be caused by Lyme disease. And I've certainly seen this a lot. My father has Parkinson's, likely due to Lyme disease. And essentially what happens is the chronic neuroinflammation that results from the infection begins to deteriorate the dopaminergic neurons that are in a particular area in the brain called the substantia nigra. And what happens is when the dopamine neurons degrade and dopamine lowers in the brain, you begin to have movement disorder. And typically what Parkinson movement disorder looks like is a pill rolling tremor, like this. Gait instability, flat affect, flat mood, anxiety, constipation, inability to initiate movement. And there's a lot of things that you can do naturally to help curb the progression. But the most important one is to limit milk. Take it completely out of your diet. Milk is a huge stressor for people that have Parkinson's, and I mean huge, like major. So you want to take all milk out of your diet, and you want to try and engage in social activity with your friends and so forth, because isolation and loneliness, similar to a lot of other diseases in old age, is a problem for older people. Human beings are not supposed to be socially isolated. They're just not. We are a social species, and we need it for our health maintenance. So take those two things out, and then add fish oil, CoQ10, vitamin D, curcumin, vitamin E, and a probiotic. So doing those few things can help change the trajectory of how quickly your Parkinson's progresses. The two causes of death for Parkinson's patient is aspiration pneumonia. When eating, the food goes down the wrong pipe and it goes down the lung pipe. And the other one is falling. So my father has fallen quite a bit. And he broke his hip. He had a concussion. Falling is not a joke for the elderly. It's really not. So, obviously you treat the infections, you treat the neuroinflammation as best you can. You can use brain-derived neurotropic factor, fish oil, CDP choline, glutathione, NAC, things like that to help decrease the inflammation. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.